This is part of a series of GWC community services on mental health. The topic is depression. The COVID-19 pandemic has had a serious impact on the mental health of many individuals. Being a new experience for all of us has meant that we are constantly adapting to the changes and challenges arising from the impact of COVID-19. Individually and as communities, we have experienced increased stress, anxiety and distress as we encounter threats to our physical well-being and to our financial security, as well as our emotional and social pressures. It is normal to have many different reactions, including grief, anger and depression, in relation to the impact of the pandemic on our lives, our communities and our society as a whole. We are seeing that the rates of depression have increased during this period. What is depression? The World Health Organization defines depression as a common mental disorder. It is characterized by persistent sadness and a lack of interest or pleasure in previously rewarding or enjoyable activities. The effects can dramatically affect a person's ability to function and live a rewarding life. An individual suffering from depression may find it difficult to get through the day, as they may have no energy and no motivation. They may feel hopeless, unable to think clearly, and they may have negative thoughts about themselves, about others and their lives. Some may have thoughts of ending their life. We all will have days of low mood and sadness. This does not mean that we have depression. The feelings of sadness must be present most of the day and for at least 2 weeks before we can determine that it is depression. What causes depression? There are many factors which may cause depression. For example, life events, for example, difficult relationships or unemployment. Personality, for example, individuals who are more sensitive or have low self-esteem. Family history of depression may increase the risk, but it is not automatic. There may be other contributing factors. A medical illness. Often the cause may be a combination of these. Drug and alcohol use may cause depression, or it may be a symptom of depression. Some individuals may not be able to identify the cause of their depression. For those with a prior history of depression, the current pandemic may exacerbate symptoms. However, even with no history of depression, an individual may experience depression under the current circumstances. It is important to remember that we are all different and our experience of depression may be different. Likewise, we all have different coping skills and different ways of managing stresses and difficulties. What is it about COVID-19 that may be contributing to depression? COVID-19 has several particular factors which may compound the experience of depression. For example, the fear of a physical or a health threat, the fear of financial threat, the daily confrontation of bad news, which is widespread worldwide. Routines have been disrupted. The physical distancing requirements have added another layer of uncertainty and insecurity. Traditional distractions and sports have been impacted. Even church attendance has changed. The consequence has been increased isolation and decreased support. What are some of the symptoms of depression? The symptoms may be physical, for example, loss of appetite or weight gain, insomnia or sleeping excessively, feeling tired, headaches and other aches. Symptoms may be emotional, for example, feelings of guilt, hopelessness or helplessness, being sad or teary, irritable. Symptoms may affect our thoughts, for example, thinking that one is a failure or is to blame, or having negative thoughts about oneself, about others, about relationships, about work, life in general, and thinking the worst case scenarios, catastrophizing. And our behaviour. We may have loss of pleasure in things that we previously enjoyed. Everything requires more effort. We're unable to get things done. There's social withdrawal. In general terms, the experience of depression describes low mood, low energy, slow motion, and not feeling good about oneself, one's life, and one's future. It may be helpful to understand what changes have occurred to previous functioning, how the symptoms first appeared, what brought the symptoms on, and how long they have been going on for. If the response and intensity is appropriate to the situation, and if there are any other contributing factors. What is helpful for someone experiencing depression? In general, looking after our physical well-being can also improve our mental health. It is important to take measures which will enable sleep, rest, good nutrition, exercise, and avoiding excessive use of caffeine or alcohol. As well as taking care of our physical well-being, it is important that we take care of our emotional and spiritual well-being. Emotional resilience is even more important at times of crises. Communication and access to appropriate supports, for example, talking to a trusted person, for example, a priest, a family member, or a friend. There is much evidence that demonstrates the positive impact of spirituality on mental health. Many people turn to their faith to help them cope with crisis and even COVID-19. Even though some of our traditional ways of maintaining faith have been challenged, Professor Santa Clara, like many others, encourages us to use our faith in ways that allow us to feel empowered and hopeful. For some individuals where the symptoms persist or there is suicidal ideation, professional help may be required. What can we be doing during COVID-19 pandemic? Maintaining a routine as much as possible, and this includes children having a routine. It is important to manage ourselves and our day, and we can do this by having a routine. By staying mentally active, physically active as much as possible, staying spiritually connected, spending time in prayer, reading spiritual books, listening to church services and spiritual talks can be uplifting and provide comfort. Avoiding isolation, finding ways to connect socially and feel close to others, even if it is not physically. Finding ways to relax or distract ourselves, for example, reading, watching a movie, gardening, cooking, craft, music. Trying to do something that gives joy every day. We need to find a balance between staying informed and getting overly stressed with information overload. Helping others decreases our stress and helps improve our mood. Engaging in activities that give meaning and purpose to our day, our lives. Being able to express gratitude for things in our life, no matter how small they may appear, can be an antidote to depression. If, however, an individual is feeling depressed every day, not managing their day, or having thoughts of self-harm, they may need more professional help, and help may be sought from a family doctor, mental health professional, a parish priest, GWC Community Services, which is the welfare centre of the Greek Orthodox Archdiocese of Australia. And the number for the centre is 1800 77 66 42.